Robert F. Kennedy Jr. has been the country's top health official for 100 days, and he's made some big moves.
Autism destroys families.
Spewing bold and sometimes factually inaccurate claims about everything from autism and measles to red dye and fluoride.
Was the COVID vaccine, successful in saving millions of lives?
I don't know. We don't have a good surveillance system.
Here's what he's gotten right and wrong. In April, RFK Jr. announced his goal to find the cause for autism.
This is a preventable disease.
Kennedy has said for a long time that environmental factors like vaccines are to blame. Researchers have identified a genetic component to the developmental disorder, but those who have studied autism for decades have found no single cause. RFK is right that there are more kids today being diagnosed with autism, and the CDC says that's because more people have access to screening, not because rates are increasing. RFK has spent decades making false claims that vaccines are unsafe. Last month, he took a 180, endorsing vaccines, but still sowing doubt.
The federal government's position, my position is people should get the measles vaccine, but the government should not be mandating.
In that same interview, Kennedy raised concerns about the measles vaccine's safety. Scientists say the vaccine is safe and effective. RFK has also wrongly claimed that people who have died of measles were already sick. Last month, after health officials confirmed an unvaccinated child in Texas died from measles, RFK said the child died of a bacterial infection and not measles. It's unclear where he got the child's medical history from. RFK says food dyes are poison and has long blamed artificial additives for chronic diseases and illnesses. And he's not totally wrong. There is some evidence linking red dye number 3 to thyroid cancer. And synthetic foods in general have been associated with hyperactivity and neurological issues in kids. Fluoride was first added into the drinking water in the US in 1945, and it worked.
They can drink away tomorrow's tooth decay.
But Kennedy calls the enamel-protecting chemical a dangerous neurotoxin and says it causes arthritis, bone breaks, and thyroid disease. Some studies have suggested a link might exist with high exposure levels, but researchers say that their evidence is questionable and that no definitive conclusions can be drawn from those studies. The American Dental Association says it's willing to conduct a high-quality study to settle the issue. A lot has happened in 100 days, and it's likely that a lot more will happen in the next 100.